there will be dramatic change. If we think about healthcare tourism, that the government, not just in Thailand but around the world, see that they need to invest in healthcare. You know, COVID was a new disease.
I do believe the pandemic situation of COVID-19 has made a lot of people turn to take care of themselves more and pay attention on their healthcare. Even me, I already plan about taking care of myself in the future already. So as an executive in Asian healthcare business, which healthcare sector do you think has been the most challenging during the pandemic?
Yeah, thank you so much, Kumping, for your question. I think you're right. You know, people are far more aware of their own health. They're aware of how to take precautions like wearing a mask. And in Asia specifically, I think we see a different societal responsibility to COVID and to their health than we do in maybe the rest of the world, which maybe explains for the lower rates of COVID. But in terms of healthcare sector, then, you know, COVID was a new disease. Unfortunately, existing diseases such as diabetes, heart disease, cancer, they've not gone away.
Right.
And what we saw that COVID has put a huge amount of pressure on healthcare resources. And therefore we saw surgeries cancelled, we saw outpatient appointments cancelled, but we also saw that public didn't want to go to hospital as well. We saw less confidence in going to hospitals because they were scared of getting infected of COVID. That will have a big impact on the outcomes for cancer, for diabetes, for heart disease, because people haven't got treated. There is a price to pay, because we've focused on COVID, and I understand that, but there's going to be a price to pay. The other sector specific to Thailand actually is healthcare tourism, because the medical facilities, some of the top hospitals here are fantastic. Healthcare tourism and tourism in general contributes a lot to the economy, and people can't travel. So we've seen, a huge loss of healthcare tourism as a result, and that's I guess, a healthcare sector, but a business sector as well, that has also been damaged because of COVID. So those would be the areas that I think have had the biggest impact. On the positive side, we see that pathways of care have changed. So, we see emergence of telehealth, telemedicine, and people not having to travel to hospital, but having their consultations virtually.
Right.
And we've seen a dramatic change in that. And I think that post-COVID, we will still see that. Specifically because, Thailand is a big country, right? We have many rural areas. And if people can have a consultation on their iPhone, explain their symptoms, they don't have to travel 2, sometimes 3 hours to the nearest university hospital. I think that's a positive impact of COVID in terms of the healthcare system. And also the costs are cheaper as well. So I see quite a lot of different trends post-COVID as well. And I really hope that the government, not just in Thailand, but around the world, see that they need to invest in healthcare.
We are seeing Roche partnering and working with other stakeholders in healthcare ecosystem. What outcomes do you expect to achieve?
It's a great question. So why are we doing that? So Thailand has got different challenges in different parts of the country. So for example, if you are a woman with breast cancer in Chiang Mai, then the clinical data that we see today shows that you're more likely to get diagnosed later on with breast cancer, which means you have poorer outcomes. If you're in Bangkok and you're a lady, you have better access to screening, to testing, to mammography, and you get diagnosed early and you have better outcomes. And that's simply because a different healthcare system, different hospital processes in Bangkok, and different processes and pathways in Chiang Mai. So what we're hoping to do is have a look at what are the differences in Chiang Mai and how we can improve those pathways of care. So, for example, women can get access to early diagnosis much earlier and have better outcomes. If we take Khon Kaen, and today we talked about liver cancer, in Khon Kaen, we know because of their diet, because they love their raw fish, which unfortunately has sometimes a parasite in it, they have a huge incidence of liver cancer. In fact, Konkan in the world has the number one amount of deaths just from liver cancer, more than anywhere in the world.
Never know that before.
So in Konkan, we need to really help understand, what are some of the challenges. So clearly people love this fish, right? I've never tasted it, but there needs to be education. Yeah, we need to think about prevention. You can actually take medicines to kill the parasite afterwards. So we need to put all of that infrastructure in place, as well as then for people who unfortunately have liver cancer, make sure that they can access the right treatments as well, and work in partnership with patient organizations, work in partnership with doctors, medical societies, to raise awareness like we're doing today, so the government can invest in those different types of therapies as well. So I really believe that if we focus on different ecosystems, we'll be able to understand the different challenges across the country and also help then improve outcomes in different ways. Many companies, for me, the most important people that we have are our employees, because they're the ones that make the difference to people's lives here in Thailand and around the world. So you have to look after your employees. So, in the first wave, we initiated working from home and made sure they were safe. We made sure that we gave them and their families masks, alcohol gel. So looking after employees, I think for me was my biggest priority. Secondly then, we have to think about how we continue our business, because our business is around improving lives and helping lives. So we wanted to think about how we could still communicate effectively with doctors, with hospitals, with our business partners. And we therefore harnessed what we call our digital communication channels. So we, for example, one of the things I'm really proud of is in March 2020, when we had the first outbreak, Roche ran the first virtual meeting with doctors from Rama of how to manage and treat COVID. Yeah? And that was right at the start of the pandemic here in Thailand. And as a result, we had nearly 600 people join a virtual speaker meeting that we hosted. And I really believe that impacted the care that people got and reduced the number of deaths. So we do so many virtual meetings and educational meetings for doctors, for pharmacists, for nurses. So they're aware of the latest advances in healthcare, so they can treat people better here in Thailand. Also, we for example, invested in Line. So everybody in Thailand loves Line. Yeah. So again, we used Line as a channel to help patients interact and get information, doctors get information, and also to provide information as well. So I think digital has been a big enabler for us to communicate, so we've invested more in that as well. And then I think the other thing I would say is we've taken a view of how do we really understand the challenges that COVID are bringing patients and doctors. So for example, in Philippines, we realized that patients didn't want to go to hospital because they were scared of getting infected, right? They have to get on public transport, maybe the bus, yeah? So we actually developed a service where we would pick them up in taxis, yeah? That were hygienically clean, and we would take them to the clinic. And we offered these types of services here as well in Thailand. And very recently, we just did a partnership with Pattani in the southern provinces. And for 2 weeks, we worked with 14 tuk-tuk drivers. And tuk-tuk drivers took nurses with vaccines and tests into communities, into people's homes. And in 2 weeks, we vaccinated 3,000 people and tested nearly 4,000 people. And these people would have never have gone to a hospital for vaccination, right? They would have never have gone tested. So again, rethinking about how we can support healthcare systems with COVID as well.
What will the healthcare business look like in Thailand after the COVID-19 situation improves?
It's a great question.
I wonder.
So I think there will be dramatic change. Yeah. If we think about healthcare tourism, I believe that healthcare tourism will recover, but I don't think it will recover fast. I think it will recover slowly. The reason I say that is A lot of Thailand's healthcare tourism comes from Myanmar, Cambodia and Laos. We know today that because of the vaccination rates, that the government is still not accepting people from Myanmar and Cambodia. They need to quarantine, so that's a big barrier. In the Middle East, so for countries like Saudi, UAE, Gulf countries, we know that during this past 2 years of the pandemic, the government has tried to invest into their own healthcare systems so they can treat people that would normally maybe have come to Thailand. Yeah? So that also will reduce, for me, I think, the tourism that comes to Thailand as well. So I think that sector really needs to change, and I think that we will see private hospitals focus more on Thai people, trying to provide different packages and different services to Thai people, which is a good thing. So I think that sector will change. I mentioned that digital health for me is also an area where I think we will see increased use. Yeah, I don't believe that for consultations, we have to go and see a doctor and travel 2 hours for a 5-10 minute consultation, right? For a checkup, for an outpatient appointment. I think we will see more virtual consultations, which I think is better for patients' quality of life, and it's cheaper and it's more convenient. In fact, in Roche, we're trying to work with the National Cancer Institute to try and reimagine pathways for women with breast cancer, so we can take cancer care to their homes. So instead of a woman sitting for 4 hours in a hospital after her and her family have travelled to a hospital for their infusion, we're hoping we can take one of our advanced therapies to their homes and give them the same medicine in 5 minutes, in their home. Yeah? So I think that this reimagining of how healthcare is delivered, I think we will continue to do that post-COVID.
I have heard that Roche has a new movement about the COVID-19 antibody cocktail medicine also. Could you tell us briefly about that?
Yeah, so if we look at COVID, then we see a lot of investment gone into vaccine development.
Right.
And we see quite a lot of investment gone into managing acute people, so people who are really ill because of COVID and saving lives. And today we have 2 medicines which are recommended by the WHO, the World Health Organization, which are on the essential medicines list. One medicine is to support people who are acutely unwell, very unwell, who may be on ventilation. And that medicine impacts a different type of pathway called the interleukin-6 pathway. Very complicated scientific, but it helps is proven to help significantly this group of patients. So we've been trying to manufacture as much as we can for the world, right? So we can save as many lives as possible. In fact, this year, we treated 4,500 people with COVID who were acutely ill with this medicine. And as a result, we would have saved many lives. So I think first and foremost, if we look at our healthcare volunteers, our doctors, our nurses, they are true heroes of this pandemic, right? So I think they've done an amazing job. Maybe they don't always get recognized for it, but they've been remarkable all over the world. For me, I believe that it doesn't matter if you are a middle-income country like Thailand, or if you are a rich country like Singapore, Australia, the UK, America. You've seen the vulnerability of healthcare systems to a virus like COVID. I hope that my message would be that governments have to have a look at why there was that vulnerability in the healthcare system, and how do we prepare for that in the future? How do we invest in healthcare? How do we invest in public health awareness? How do we make sure that we take the lessons and ensure that if this happens again, because hopefully not in our lifetime, but it might happen again, if there's another pandemic, that we're more prepared for it this time. So investing in healthcare for me is really important.
Okay, thank you very much for today.
ครับ
ขอบคุณมากค่ะ
Thank you so much.